Good morning. My name is Stephen Gibbs. I'm a firefighter paramedic for the St. George Fire Department. Here in St. George, Louisiana, we're the fifth largest city in Louisiana with a population of about 86,000. Nighttime, daytime populations over 100. Out of 8 stations, we cover 82 square miles, and we ran over 13,000 calls last year for fire, EMS, public service, you name it. This is one of our 8 stations. It's our headquarters station, Station 60, off of Airline Highway. And what you see here is the administrative portion to the left, the fire station to the right. This is my station where I'm actually working today. My unit is right down there on the right. Right there next to it is an additional sprint truck. So we run 2 of those, one acting as the shift supervisor. That would be me. And next over would be one of our squads. We run 2 of those out of the district, or I should say out of the department, one being here. Additionally, in this station, we run a safety unit who acts as blockers on MVCs. They go to any major incidences, MCIs, active shooters, anything of that nature. And then we run an assistant chief who oversees all the daily operations across the department. So I chose to do this presentation on a particular population, uh, specifically in regards to a patient that I became friends with that I'll kind of introduce here in a moment. But out of the 86,000 people, we have a considerable amount that are into elderly range. We have a number of assisted living facilities, nursing homes, but then also additionally, we have a very large amount of people that live alone, maybe with a family member helping take care of them, maybe with home health, visiting, if they're lucky. Sometimes they're not even lucky enough to have that. But we do have a pretty extensive call volume in regards to elderly patients for medical emergencies, uh, assisting invalids with lift assists, public services where we're checking their equipment. Um, so I really began to base my presentation off of this population. One person in particular really inspired me, and you'll see her in this picture here is Miss Barbara Taylor. In April of this year, we ran a call on Miss Barbara for respiratory distress. Her SpO2 was down in the upper 80s, and she was a little bit concerned. And when I began to make contact with Miss Barbara that first time, I really took note of not necessarily her medical um, condition, but more of her emotional condition. She was very lonely. She was very concerned. She lives by herself. She's on home oxygen 24/7, and so for the things that would be of very little concern to most people, um, causes great anxiety for her. You'll notice that right now she's hooked up on the monitor, checking her vitals. She is on home oxygen. That nasal cannula line goes to about a 30-foot line that runs all the way back to her concentrator. She has also, in addition to that, a battery pack, a portable concentrator that lasts about 3 hours. I apologize, 3 hours. And then additionally, she has 2 oxygen cylinders that each run about 6 hours. As I began to know Miss Barbara throughout that call, she struck me not only in the way that she personally presented, but she also struck a note with me um, within myself on a personal level. My grandmother lived in this district. I was very close with her, coffee 3 times a week. And I was very, very close with my grandmother and ended up losing her June of last year. She had a catastrophic fall, and unfortunately, she did not make it out of the facility. And so meeting Miss Barbara, it really just instantly kind of reignited a sense of concern and wanting to provide comfort for somebody. And so shortly thereafter, I ran that first call with Miss Barbara. I reinitiated contact. I drove by her house one day. I just knocked. She came to the door and she was really blown away at the fact that I just wanted to swing by and see how she was doing. We visited for a couple hours. I checked her vitals, looked at her oxygen concentrator, refilled her reservoir, and from that initial contact in April, I have been by her residence around 8 or 9 times, a mixture of on and off duty. Um, and we've really become quite good friends. She sent me a message on Father's Day, wishing me a happy Father's Day. Um, but again, I got consent to use her pictures, and she was very interested in being featured in this presentation. So I really wanted to base the foundation of this presentation around her. You'll notice here, obviously, the color of her shirt has changed, and that's because this is a different day. I'm actually off duty right here. Um, I gave her a call. I said, "Hey, Miss Barbara, I'm around the corner. I just wanted to check and see if you needed anything." And every time I call her, I can tell that she doesn't want to bother me, but she always really enjoys the company. And so if you'll notice, she is, frail in age, but you'll notice that she has a smile in this picture. And every time I go to visit her, she seems to have a real um, observable sense of comfort. And to me, that is the most impactful thing that I get out of visiting with her. You know, I'll go and sit with her for 1 to 2 hours if I'm off duty. If I'm on duty, I'll sit with her for about an hour before I usually have to catch a call. But the goals and objectives for my presentation for this model of response and mobile and integrated health is to target this elderly population in our district, provide them with some reassurance, some comfort, the knowledge that they're not alone, because I really sensed that in my first contact with her, that not only did she live alone, but she felt alone. She does not have a very supportive or extended family network. She doesn't have any children. She was divorced many years ago. Most all of her family lives out of state. And the only contact she has is home health that visits 3 times a week for a few hours at a time. Outside of that, she's on her own. And that really kind of just hit home a little bit for me. Additionally, one of the objectives, and I know that anybody that's in emergency services sees the misuse of any services. And Miss Barbara is not misusing any portion of it at all. But what I do think can happen is that we can more intelligently disperse call volume amongst necessary resources. And what I mean by that is, the first time that we ran a call on Miss Barbara in April, she got an ambulance, she had a fire truck, and she had a sprint truck. By the end of the visit, we checked her machine, checked her vitals, we got a refusal, and she just needed reassurance. And I don't think she needed all three resources there for that. So another objective of what I'm presenting is that we more wisely utilize and dispatch resources that we're not using or initially dispatching transport resources on calls that may only be, I got a burn on my finger. I need you to look at my oxygen concentrator, as in Miss Barbara's case. So I really feel that we can implement a very impactful change by just tweaking a few different things. And we're going to really kind of get into the different ways in which we'll impact those. Thirdly, I want to see Miss Barbara's quality of life improve. I want to see, one of the most contributing factors of decline of health is the feel of despair. And I really truly believe that when patients feel like they don't have much to live for, when they feel like they are alone, that's really when the decline begins to set in. I was lucky enough to have my grandmother till she was 93. My mother lived with her, helping provide care. Again, as I said, I visited 3 times a week, but through my work, I see so many patients that don't have those luxuries, that don't have that network, and their quality of life reflects it, unfortunately. In this picture below, you see 4 Sprint trucks. Those are our 4 units that we run. And my proposal for the method of implementation is that these Sprint trucks handle the majority. They'd be dispatched out on all medicals. Currently, right now, as it stands, our department's policy is a suppression truck or a rescue apparatus is sent with a Sprint truck on every single medical. So it could be um, a 10-year-old that was skateboarding and he rolled his ankle. And guess what? He's going to get a rescue truck or a ladder truck or an engine along with a Sprint truck and an ambulance. And at the end of the day, we're really there to provide every bit of comfort and treatment that the family and patient desire or need. And I would never advocate for a patient to receive less than what they deserve. But where I do believe that we can more wisely redistribute our assets is these 4 units right here. In our department, I believe that we could have a redistribution, a change in our dispatching to only attach rescue and suppression units on priority 1 medical calls, 1 and 2. So in the event that it's a respiratory distress, asthmatic, anaphylactic, cardiac arrest, stroke, things of that nature, obviously send additional resources. But in the event that it's a level 3 medical, which we run a very good bit of, I do believe that these Sprint trucks could go out on a simple abdominal pain. And granted, cardiac events mask under abdominal pains. Aortic aneurysms can mask under abdominal pains. We could what if all these different types of things to death. But for the most part, we see a large portion of our call volume that could easily be handled with an initial response of one of these 4 Sprint trucks, provide a very immediate ALS assessment. We have capacity to provide 12 lead monitoring, IV access, full frontline assembly of drugs. We have narcotics. We have everything in this unit that the ambulances in our district have, without the exception of transport capacity. And if we are on scene and we discover that that level 3 medical is indeed a critical emergency, that's no problem. We can stabilize that patient with that medical on scene while we request additional resources and, really kind of evolve the call from there. But I really believe that what this model would do is it would really help our neighboring transport agency, East Baton Rouge Parish EMS, would allow them to continue to provide priority level care to the remaining city and parish. So therefore not tying up any unnecessary transport units with calls that we could easily be handling ourselves. And if we are on scene, and say, for example, in Miss Barbara's case, because I did do this with her, I made note with our communications center that there is a key under a particular lawn feature in her yard. I gave them her address. I said, here's the deal. We have a patient, home oxygen. She's very dependent. I need you to flag this note in her file so that future medicals, we can have responding units know how to gain access to her residence. And the last point in this slide really kind of hits home on that. If there's things that our responding apparatus and personnel observe that provide us with the concern that this is going to be a repeat call or that they need special attention thereafter, then we just pass that information on to our communications, and the communications will help with their documentation and further uh, assisting in calls at that address. So one thing that I believe that this model could uh, greatly impact our department is through a few different components. Um, Cost savings, manpower efficiency, and streamlining our services. So cost savings are in a few different categories: apparatus maintenance, oil changes, tires, also consumables such as fuel consumption. There's a lot of our uh, meetings and trainings that have to be conducted off duty, so they're paying overtime, and I feel that freeing up our suppression and rescue resources as much as possible will allow them to complete more trainings and meetings on duty, therefore reducing the amount of overtime necessary. Employee fatigue. We all know that that is a really huge component in what we do. Employee fatigue is something that anybody who's spent a career in public service knows what a sleepless night can do to you. So if we can more wisely redistribute the call volume, not only allowing um, our units to be better served or more wisely dispatched and attached to more appropriate calls, it's reducing that workload on our staff. We do know that these guys have families. These girls have part-time jobs on their days off. So that's always going to come into play. And we know that improved response times for more calls. So if it comes out with that, 10-year-old skating and he rolled his ankle, I don't need an engine. I really can't tell you how many times in my 6 years here at this agency, this is my 21st year in the fire service, but I've been here for 6 years helping start the paramedic program. In just my 6 years here, I can tell you there have been countless times where we have been on a medical call. Patient is very stable. I'm very well within my means to manage, monitor, and treat the patient by myself while we wait for a transporting ambulance to arrive. And lo and behold, a reported structure fire report pops up in our district. And I have every time turned to the captain on the engine. I say, I'm good, y'all go. So I really do believe that by reducing the call volume for the engines and rescues to only the category level 1s and 2 medicals, and then also medical assists, good intent calls, things of that nature that I've highlighted down to the bottom right. It's going to reduce their call volume. It's going to really help them have better response times to the calls that they're more appropriately tasked for. All around, I really think that it's going to be a better thing for everybody. Trying to go on to my next slide. Let's see. Let me pause and move on. We're attempting to move on to our next slide. So to begin this process within our agency requires zero startup costs because we're already running the resources staff needed to get it going. So we don't have to go to any external stakeholders for seed funding or any outside agencies to try and do a coordinated regional program. There's nothing really necessary for that. I really feel that we're able to begin this process internally and sustain it. And our funding would come in the form of cost avoidance. And the way that I've kind of tried to break down the numbers is by looking at the amount of calls that I believe that we could save our suppression and resource trucks from responding to. And then I calculated certain components, particularly in fuel. Around here, I'm not sure where anybody else is at, but particularly in fuel. Diesel running around 330 a gallon at the moment, but we all know that number fluctuates up and down. But by my best accounts, and I was running on a conservative estimate, is that by changing the way in which our suppression and rescue resources are dispatched, reducing the EMS assists, the good intent calls, the level 3 medicals, is that we could save our rescue and suppression apparatus around 2,500 calls a year. And at the moment, we run 8 engines, 2 squads, and 3 ladder trucks, with each holding a fuel tank of around 45 gallons. And our agency, much like many others, has a policy: we fuel up at 3/4 of a gallon. 3/4 of a tank. And so by factoring in all of those numbers, we looked at roughly, give or take, about 144 gallons a day, plus or minus, that all of our suppression and rescue apparatus are having to consume to stay on a full tank. Now, at current market value, $3.31 a gallon, if we say 144 gallons a day, even being on a conservative estimate, I believe that we would save our department, if we changed the dispatch policy, around $53,000 annually in fuel alone. That's not even considering some of the other consumables that we'll discuss here in the next slide. Additional savings. I had spoken personally with through email with our Chief of Special Services, which is the maintenance division, and he really elaborated in specific about what the cost is for oil changes and tires within our agency. An oil change on one of our suppression and rescues runs, just for the oil alone, $95. The labor is $150 for a total cost of around close to $250 per truck. And then once we look down on the tires, each tire, being whether it's on a aerial truck or a engine, runs between $500 and $700. To have that tire replaced, if it were done off-site, is $150, but we do outsource our maintenance in some components and capacities to have them come on site and do certain repairs or services. And if we were to have this party come on site, which they often do, and change our tires, that would be an additional $100 to $200 in addition to the $150 already. So we have the very real likelihood of an entire tire change on these apparatus running over $5,000. So if we can keep these trucks off the road, it not only saves staffing fatigue, it not only provides them more ample opportunities for training on duty and meetings, it not only saves the cost in fuel, but we're also saving other consumables such as oils and tires. Another way for cost savings is what we went on over earlier about freeing up these apparatus and staff to accomplish more things while on duty, as opposed to having to be done off duty. What you see in this picture right here is Assistant Chief of Special Operations Wes Mondrick. To the left, you'll see to the right is Josiah Atkins. He is a firefighter operator in our rescue division. And Josiah is off duty. He was brought in off duty to help assist with training in this multi-agency drill. And I believe and I feel that when we operate with a more efficient, streamlined pattern and dispatch and response model, is that we provide more opportunities for these type of things to be conducted by on-duty staff, therefore eliminating the need for as much overtime. And I'm sure some people look at that as overtime as additional income, and I understand that. I do as well. I've got some overtime shifts coming up this month. But when you're looking at it administratively from a cost perspective, you really have to consider things like budgets. So I do feel that that would be a really good, strong way for us to implement good, solid change and have um, a positive impact in our budget as well. Objective outcomes, how can we really measure what we're doing? As I described before, just the expression on Miss Barbara's face, the comfort and security that we can provide them just by simply taking an extra step, knocking on the door, visiting, checking, those type of things. And then secondly, we're defining our response plans within our agency, but also our region. If we can implement change, and we've done this through our agency with a number of ways already. We were the first in our parish to bring in advanced EMTs, and now our agency requires you to be advanced EMT to even promote. And because we have pushed such a strong initiative with our advanced EMT program, there have been a number of other agencies that immediately neighbor us that have jumped on board. So I think we've already established change within ourselves, but also those around us. And I think that redefining our response plans would be another way that other agencies could look at us and say, hey, they're doing something that's really being efficient and it's really working for them. Let's give that a shot. And then bridging the gap between public safety and home health entities. You know, Miss Barbara, again, as I said, she does rely on home health, but she's expressed to me also before that there have been billing concerns and she's lost home health visits because of, insurance payments or whatever the case may be. And it's really sad that things come down to that. But obviously, I began to understand that with Miss Barbara in her case, there's a gap. There's a lapse in coverage for her where if we're not there to check on her and her home health is not there to visit her, she is there by herself. And if she has an issue, it's really up to her to either figure it out on her own or to call us for help. So, I think these things are going to be able to bridge gaps with the home health as well. I mean, between home health and public safety. And really just kind of recapping some of the goals for our program is resource management. Resourcing or resourceful application for our apparatus and staff, making sure that we are utilizing most efficiently the tools and the people that we have. Faster responses to incidences with appropriate tools. So I can't tell you how many elevator calls come into our district. And if I have that squad with me on Miss Barbara's SPO2 of 90, then they are being tied up in certain instances. I'll never use the word unnecessary with Miss Barbara or any patient of her nature, but it's unwise and inefficient for us to place that type of apparatus in a situation that delays it from being utilized for what it's more specifically designed for. And then thirdly, as we've discussed before, the goal of this program, resource management, is that we're maximizing the efficiency for our staff to be able to be utilized on duty for things such as meetings, presentations, trainings, fire safety presentations at schools and safety walks. And we do a lot of those type of things where we go and visit schools. So I really feel that by implementing this program, it's going to free up so much time for those other assets to be accomplishing other relevant objectives. This next slide has, we're talking about financial responsibility, fiscal devoir. I kind of thought that was an interesting word. I looked up synonyms of responsibility and that one popped up. So I thought, why not? Let's throw it in there. But essentially, it comes down to some key components that as managers, as administrators, they have to be paying attention to where the money is going. what are we receiving for our financial contributions as a department? Um, and if the department's not really seeing any benefit to the buck, then you know we're probably not going to that program's probably not going to last very long. So awareness of how operating plan affects the department budget. Plain and simple, you have to be smart with your money. Second thing is to have net reduction in consumable products such as tires, oil, and fuel. I do truly believe that that was going to be the very first area that we would see a financial impact is the fuel, because we fuel on a daily basis. Tires and oil, you'll probably see that over the next year with how much you ended up saving. Um, so that number might be a little bit tougher to really kind of balance out to get a projected outcome. But I think that fuel is going to be a game changer within within the first week or two of being implemented. I think that you would see that number being drastically reduced. Thirdly, reduction in overtime with providing more opportunities for on duty. Apologize, I'm on duty. And lastly, we have to be smart because public service agencies do not operate with endless piggy banks. We operate on the financial contributions through millages and taxes that the public entrusts us to be responsible with. And when we ask for money and we give them the reasons why they should vote to renew or vote to pass, and we don't show responsibility, the likelihood of passing those type of efforts are going to really greatly be compromised. So I think if we can show the public and say we have implemented policies and changes that have shown proven reductions in consumables and finances, and it's made our efforts and our resources more streamlined, and it's providing you a better service for less money. To me, the public is going to jump on that every day of the week.